My name is Savannah Goodman. I'm 20 years old and I'm from St. Augustine, Florida. I'm going to be a rising junior at Duke. My major is biology. I'm a minor in chemistry and religion. I'm also on the pre-med track. I work for student wellness on campus. I also got EMS certified through Duke. And I work in a immunology lab through the medical school. I was born with a primary immune deficiency. It's a genetic disorder that causes my immune system not to work properly. It's presented itself as infections throughout my childhood. It started at about 6 months old. I had ear infections, asthma symptoms, respiratory infections, and doctors couldn't figure out why I was always sick. I saw many specialists throughout my childhood trying to get diagnosed. Finally, at about 6 years old, my mom brought me to Duke, where I saw Dr. Roberts. He diagnosed me with something called common variable immune deficiency. It's a type of immune deficiency under the umbrella of primary immune deficiencies. It's actually not exactly what I have, but it was on the right track, so I started treatments with IVIG, which is gamma globulin infusions. This helps control my symptoms and infections so that I could go to school and lead a fairly normal life as a kid, with the exception of chronic infections. My visit at Duke when I was 6 years old, I went with my mom and my grandfather. My granddad brought me around the campus and showed me Duke, and I fell in love. There were twinkle lights up at the time, and I just remember it looking like a palace. And that's actually what inspired me to apply to Duke when I was in high school. So after I was diagnosed at Duke, I continued care in Florida, seeing an immunologist locally. Around 9 years old, I started infusions subcutaneously so that I could do them at home. It made me a lot more independent and made it so that I could lead even more of a normal life. The side effects of the infusions were a lot less than the infusions that I used to get in the clinic. So I missed less school and was able to do more things. And then I saw an immunologist in St. Petersburg, Florida, that changed my diagnosis to severe combined immune deficiency. He had done genetic tests that showed a mutation on my RAG1 gene. So I have no B cells and no B cell function, and I have no T cells and very low T cell function. That basically means my immune system doesn't function very well, but it does have a tiny bit of function. This disease is more commonly known as bubble boy disease. This past spring, my T cell function crashed, causing my immune system to basically stop functioning at all. I got a pretty severe infection called Campylobacter that caused me to be in the hospital on and off for about 2 months. My doctor decided the best route to go was a bone marrow transplant because with my T cell function so low, it won't recover on its own, and my immune system will keep crashing until I have no function left at all and it stops working. So a bone marrow transplant can correct this by replacing the bone marrow within my bones with bone marrow from a donor, and then the bone marrow will start replenishing itself on its own, and I would have complete B cell and T cell function. This would mean that my body would have a fully functional immune system that it could keep up on its own without infusions, medications, or treatment of any kind. So I would be able to lead a normal life. We found a donor through the National Bone Marrow Donor Program who will be donating their bone marrow in August. In order to do the transplant, we first have to do a round of very severe chemo to clear out the bone marrow in my bones to eliminate all remaining immune function left in my body so that when the donor marrow is put in, my body doesn't fight against it. I've spent the last few months in and out of hospitals trying to get rid of any infections that could be in my body and complete testing for the transplant. In order to do the transplant, they have to check everything that could possibly be wrong. So I've been seeing eye doctors, dentists, cardiologists, ENTs, neuropsychologists, basically every doctor for every body system, running every test, EKGs, echoes, kidney function tests, liver function tests, gallbladder tests, everything under the sun to make sure that my body's ready for transplant. All those tests have been done, and now we're just making sure I'm infection free from now until transplant. August 10th, I'll go into the hospital to have a central line put in. I'll go under anesthesia, and there will be an incision put in my neck, and then the catheter will tunnel through to my heart to create a direct line to my heart. There will be 3 lumens. They're little external ports to the catheter so that the doctors have and nurses have access to put in as many things, 3 things as they need at once. So they can put in TPN, which is total parental nutrition, since I won't be able to eat very much, if at all, for a little while. The chemotherapy, they can get blood that way. And then I'll be admitted to the hospital that day, and that night they'll start chemo. The chemo lasts about a week. It's very intensive chemo, unlike the chemo they use for cancers, where it's stretched over a long period of time. It's basically non-stop chemotherapy for 7 days. It's also one of the strongest chemotherapies that is on the market, so that they can make sure that there's absolutely no remaining immune function before they transplant the bone marrow. Then, after the chemotherapy, there will be 1 day of rest so that the chemotherapy can clear out of my body so that it's ready for transplant. Then the actual transplant will occur. It's actually an infusion, not a surgery. Much like the chemotherapy, it takes a few hours. They infuse the bone marrow, and then we wait. I'll be in the hospital about 2 months waiting for what's called engraftment. Engraftment is when your levels, white blood cell count, red blood cell count, platelet levels, start to go up enough that they see that your body is accepting the bone marrow as its own. This can take about 2 months, and during that time, my body will have absolutely no immune response, and I will be extremely susceptible to infection. I will be in a special ward in the hospital that is under isolation. There are special air filters and policies in place in this ward to make sure that no infection gets near me or anyone in the ward. If I incur an infection at this point, it could be fatal because my body will not have any means to fight it with. After I engraft, they continue to monitor your counts, make sure you're infection free, and then hopefully send me home, where I will be in isolation for another 6 to 9 months. I will be at home. I won't be able to go to crowded places, such as the grocery store or the movie theater or class, anywhere really where people can be coughing or sneezing, or just the smallest germs could be around. Slowly, I'll be allowed to reintroduce myself to society after about 9 months, starting with very low volume places, mostly outdoors at first so that the air is open and circulating, and then I'll be able to go to like a quiet movie theater in the middle of the week during a low volume time, and then maybe the grocery store at a low volume time. things like that. During the time when I'm back at home but not in the hospital, I'll continue to have to go to clinic, at first at least 5 days a week, and then it'll slowly taper down to 4 days, and then 3 days, and then 2 days. So I'll still be seeing the doctors a lot, having blood draws a lot. I'll still be on artificial nutrition. I'll be receiving medicines at home. I'll still have my central line in. I'll need 24/7 care during this time and during the time that I'm in the hospital. I'll be responsible for drawing my own blood from the central line and bringing it to the clinic. I'll be responsible for making sure my artificial nutrition is running over the night and that I'm getting any IV medications that are needed all through the central line. I'll also be responsible for dressing changes of the central line, making sure that that central line stays clean, infection-free, and cared for. Because this is a lot of work and a lot of effort to keep track of, especially during a time when I won't be feeling 100%, I will need that 24/7 care. My family has moved up here temporarily to Durham in order to help with the care needed during transplant. My mom has had to take off work and come up and get an apartment up here that we can use as a temporary space to keep me infection free and healthy during the transplant. She'll be in the hospital the entire time that I'm there, and then afterwards she'll be caring for me at home. She's been up here since the beginning of July, and she'll continue to stay through the transplant. At the end of this, the goal is that I will be cured, that I will have a working, functioning immune system. I won't require the 25 plus pills I take a day now. I won't require any of the infusions, constant doctor's appointments, and I'll be able to live a healthy, normal life. Because of all the care needed during transplant, I have to take a semester off of school. I'm very upset because I love my semesters at Duke. I love my classes and getting to do what I love in such a place full of opportunity. Fortunately, I worked out for the spring semester to be able to take classes online, to continue working on my studies, but I'll still be away from campus for at least 2 semesters. But then I'll return to Duke, hopefully healthy and ready to work towards my goal of becoming a pediatric immunologist. My time at Duke has inspired me to go into the field of immunology. I hope to be able to work with kids who have disorders similar to mine and to be able to help them through this process. It's very scary being a kid that's always in the hospital. It's very intimidating to be in a medical setting as a kid, especially when you don't understand what's going on, and sometimes it's hard for people, doctors, to explain what's going on to kids. So hopefully I'll return to Duke ready to conquer the rest of my undergrad and then continue on at Duke Medical. Thank you.